All right. Hello, Journey. I got Dr. Cilip on the line with us today, and I thought that it would be appropriate for our nutrition, our weekly wellness seminars that we do, to have Dr. Cilip on and talk with him about the coronavirus as it pertains to people in general and as it pertains to our area. Today, I'm wearing my overcomer gear because we will overcome, right? So Dr. Cilip, thank you for being on here today. Thanks for your time.
Yeah, thank you, Travis.
Well, I wanted to talk a little bit about fears and facts. I feel like, there's definitely a lot of hype going on. There's a lot of people that are not experts, that are not doctors, that are speaking on the subject about, what we should do and just, what's real. So in our area, as a doctor that's, staying in the loop with other local healthcare professionals, how many cases are there of the coronavirus that have been detected in our area, to your knowledge?
Yeah, I think the reporting is probably a week to 10 days behind, but it's still probably numbers no more than a dozen that have actually tested positive. Then the question is, how good is the test? Who are we testing? Are we missing tests? All of which, the answer to all of those things is positive. We are missing testing people. The tests are probably not perfect. The bottom line is, and one of the best, I'll start right out by saying one of the best places you can look is on the CDC website. They update it twice a week with numbers, the best numbers they have. Since the testing is now being done by places other than the CDC, the numbers again are lagging because areas like ours may not report for a week or so. But it's shown that the cases have been steadily rising. The number of tests available have been extremely limited. Now the recommendation is you only test someone if it's going to change the way you're going to treat them. You don't just do screening anymore. And then there are, again, other places, drive-through sites that will get a bunch of tests and do the tests fairly quickly. So it's still a bit of a mishmash. But in terms of the number of cases here that have been actually proven, it doesn't seem to be terribly high. There's an important thing with the statistics, though, for a disease like this, and that is if you start to see cases in the community and they start to rise and you haven't seen any deaths, that's a very good sign. If the first cases you see are deaths in intensive care units, you know that you have a very, very rapid spread of a very, very bad disease. So I think it's proving in our area that it's what everybody has said, that the majority of people who get it either don't know they have it or they get cold and mild upper respiratory symptoms, whereas somewhere around 16% actually get sick from it, and only a few percent of those wind up in intensive care. And that's the group that has a higher mortality or death rate.
Yeah, so you're actually bringing up two interesting facts that I wanted to touch on today. One is, so I've heard this statistic, and I'm not sure, where it is to you, but I've heard that some say over 80% of cases are mild. Would you agree with maybe that statistic? Is that about right?
That's what everybody is saying. And having watched areas all the way from China to now the epicenter here in the United States is in New York and New York State. California's had a number of cases, and that's what the statistics do seem to bear out.
Okay. And then with the cases that are rising on a regular basis, you mentioned testing. I think it's important. That's why I said fears and facts. Like the reason that sometimes the amount of cases are doubling on a daily basis, is it more due to detection or is it more due to just how fast it's spreading, right? Because I think that's important. Sometimes, we get news that's rather alarming and we feel like it's just spreading so rapidly, but it was just a week or so ago that we were barely testing it, right? So, what would you say? Is it more due to detection or is it more due to just how rapidly it spreads?
I think those two things go hand in hand. As we've done more testing, we've seen more evidence of the disease, but it's also spreading. And again, from the CDC website, we just need to be ready for the fact that everybody's going to be exposed. How many people actually get it? How many people get sick from it? That seems to be that 80-20 number, but it's something that's quite contagious, and over time, everybody will be exposed.
By the 80-20 number, you mean that of the exposure of the people that are exposed to it, maybe 80% get it, or maybe 20% get it?
No, of the 100% that get it, 80% either know it or it's asymptomatic. And if it is symptomatic, it's mild. Where the other 20%, 16% is the latest number, actually have some sort of an illness that is significant to any degree, like the flu that keeps you home in bed for a few days.
Okay.
A very low percentage, and generally the very compromised, um, are the ones who have problems with a higher mortality rate.
Okay. Now, let me ask you, I've heard of a situation where there was a husband and wife on a cruise ship, clearly sleeping in the same room, and one got it and one didn't, which just speaks to the idea of immunity. And I know that you've worked with me on a supplement program. You've worked with me on a dietary program. We work together on exercise. And so I wanted to, touch today. I mean, I would think that speaks to immunity. You tell me what it speaks to, because certainly you can go more in depth on that. But if it does speak to having a strong immune system, maybe just some recommendations on what people can do to, boost their immune system at this time to try to have some natural prevention against, catching the coronavirus.
Yeah, and I think that you are your immune system. So if you're somebody that is physically not fit and who eats poorly, a smoker, heavy into alcohol use, those are all things that diminish your overall strength, and by the same token will diminish your immune strength. Staying physically strong, very important, and your diet is absolutely critical. We talk about all of the different supplements you use, but if you've got a protein depleted diet, or if you have a diet that's, we'll use the word depleted because you overdo it with exercise and underdo it with food, whether you're an undereater or you're just a poor eater, that's going to affect you significantly. We don't have a great way to test your immune system. You can have normal levels of immunoglobulin and normal levels of white blood cells and still have a immune system that's on the weakened side. It's very difficult to test somebody and say your rating for your immune system is 85% or 95%. But if you do a web search for foods that help improve immunity, it's going to be extremely intuitive. You're going to see the things that you would have thought you'd see. Lots of green vegetables, especially green leafy vegetables, especially dark green leafy vegetables. Good solid protein sources, both animal and plant. It's going to be the things that you already know about. Fruits, berries in particular, can help stimulate your immune system. And then if you look towards supplements, you'll see varying studies with varying degrees of validity about things like echinacea and astragalus and elderberry. If you read the Native American ethnobotany studies that have been done, you find different plants. And again, the things you would think, the berries, the green vegetables, that can all be, and elderberry from those studies can all be helpful. So I would tell people to do the research on your own. If you research 10 articles that talk about immune supplements, you're going to find the top 3 or 4 listed in every single one of those articles, and that can be helpful. When you talk about your food preparation, it's known that oregano in the presence of pepper is antibacterial, not necessarily antiviral, but antibacterial. And any of the harsher spices, sriracha and Tabasco and things like that, have all been shown to have antibacterial and some degree of immune stimulant properties. So when we're cooking, when we're buying the food, when we're planning our meals, you can really focus on immunity that way.
That was really great, because you touched on some things that I don't think are as widely known. And then many people talk about things like vitamin C, zinc, garlic. Would you agree that those are good things at this time as well? Or
yeah, and I think you have to be careful of when the articles come out, because the press is having a field day with this, and they seize on things like, oh, zinc is the cure. Well, zinc is certainly good for your immune system, whether you're getting it from your foods or a supplement. Vitamin C, important for a healthy immune system. Do you really need more than you get from a diet that contains citrus and green vegetables? Don't know. Vitamin D, that's something we don't get enough of. We can find it in green leafy vegetables, but interestingly, after you pick them and take them home out of the field, the vitamin D dwindles very quickly, just like the vitamin C in oranges goes away rapidly after you pull it off the tree. So a vitamin D supplement can be useful. Um, One of the things that I'll try not to go down a rabbit hole with, but the press, both political and the general press, talking about the use of chloroquine and hydroxychloroquine, and this is going to be the new antiviral. When you look at the history of those drugs, they've been studied against every virus that has ever come along: the cold virus, the AIDS virus, the Ebola virus. And in Nigeria, for instance, during the Ebola crisis, they had to finally outlaw the use of chloroquine because of so many people dying from using it. It's not a benign drug. And yet yesterday I had incoming messages from 3 separate pharmaceutical or prescription companies saying that my patients who had lupus could not get their chloroquine, and in 2 cases could not get their hydroxychloroquine because of a national back order. Everybody's hoarded it. And I would just encourage anybody watching to not think that this is the cure-all. A lot of people who have hoarded this stuff and take it are going to get hurt by it. That's not a benign drug. So.
You're speaking about 2 very important things. Let's talk a little bit about hoarding right now. There are a lot of people walking around with masks, and there's a lot of healthcare professionals that need those masks, and that's a situation. So what is I want to speak to actually a couple things as we talk about this. There's a lot of people isolating. They're isolating themselves from even close friends and family because they're scared. They're scared. All you have to do is turn on the news if you want to be scared, And so maybe if you could speak a little bit to the importance of isolation and who should be walking around with a mask, and when that's necessary, when it's not. If you could talk about those couple of things, I think it would be good to have not a news perspective, but a perspective from a doctor that's part of our community that, knows and loves us, and somebody that we can trust.
Yeah, well, I think you have to be cautious, but I don't think afraid. The social distancing is reasonable. Do you have to stay away from family members? I don't think so. Do you have to stay out of crowds and, the venues like concerts and, unfortunately places like the gym? That's probably reasonable for a continued length of time, probably not a very, very long time, but that's provided for the benefit of what we call flattening the curve. By reducing the speed of the transmission, then you'll reduce the number of cases. And that comes into play next is, well, how long is this virus going to survive? Is this thing going to last on into the summer and the fall? Don't really know. The virus kind of caught us blindsided. There hasn't been a lot of valid research done on it. What's it going to do with the water supply outside? Is it going to live in the mud and the wet roads and get aerosolized by cars driving around like Mycoplasma and Legionella can do? Don't know that yet. So we have to say, let's do what we can for a period of time to reduce the transmission. Now, there was a town in Italy that where they tested absolutely everyone, the entire town, and they isolated the people that had it, and for 2 weeks, and the virus essentially went away in that town. So it's not that the isolation periods have to be for a long time, but it really does have to be sensible stuff. We don't have to stay in our home and have groceries delivered and set on the front porch and then wipe down before we bring them in. That's probably overkill. What we do have to do is, when you go to a grocery store, wear a pair of gloves so that you're not touching the cart that a lot of other people have touched. And make sure that if you pick up fruit or things that have been picked over by folks with bare hands, that you wash it before you eat it. And, I had a discussion with somebody the other day about, well, what if you touch the pizza box that the guy made the pizza in? Is there a chance you could get it? Never been studied, but probably there's a chance. It's just, there's a lot bigger chance if you're hanging out in crowds and there are people who are sick and coughing. A lot worse on an airplane or a bus than it's going to be on a trip through the pizza parlor to pick up something to eat.
Mm-hmm. Yeah, you speak to a good point about gatherings, which is why, gyms have been closed, or, different churches have been impacted, and things such as that. So they talk about gatherings of people less than 10, if you wanted to have some people over. I heard one guy say to me, well, we already got a family of 8, so we can only have over 2 at a time, or, you know, whatever, like that's the situation. So when it comes to screening, you know, who you would actually allow into your home, you know, and that process, you know, because some people are still having guests in their home and whatnot. Is there any recommendations that you would have for us on that, or, you know, how that would go if you were just having a small gathering, you know, close friends or family members?
Well, yeah, I wouldn't have me over to your home because I'm working with patients every day, and I'm not sick. I don't have any symptoms, but I wouldn't have somebody like me over to your home.
Mm-hmm.
If it was somebody that was working with large crowds of people each day and there had been sickness reported there, until that person is gone for a number of days without being sick, I would be careful about hanging out with them. But, you know, if it's somebody that's been quarantined much like ourselves, I think that that's perfectly reasonable for those folks to be together. And again, it's all based on statistics. The smaller the number, the less likely you are to come in contact with somebody that's contagious.
Mm-hmm.
And in speaking about the contagion, you talk about, well, there's an incubation period of between 2 and 14 days. What that really means is that very few people are sick within 1 or 2 days, and very few people wait until the 14th day to get sick. So if somebody's been okay for 4 or 5 days or up to a week, then they probably have not gotten infected. Again, that's a curve, and the statistics say that the people toward the middle of the curve are going to be the ones that you actually see.
So that's a good rule of thumb. If you were quarantining and I was quarantining and neither one of us had shown signs for a week and we're not exposing ourselves to large groups, then we might be okay to get together. But because you're seeing people on a daily basis that are being screened for that, then of course there could be an issue where you could be carrying something. So just kind of looking at it from that perspective. Are you going near large groups of people? Are you coming in contact with people that could have it? You know, somebody's, you know, been down to the city or screening patients. That could be a good rule of thumb. Well, so I want to ask you, when it comes to this virus, you know, many people compare it to the flu. You know, they're talking about, you know, if it's the flu is more dangerous or this is more dangerous or whatever the case might be. Why are we so concerned if it is like the flu? You know, I suppose it has something to do with maybe the support or the treatments that we have for it. But I just wanted to kind of get your perspective on it, because I hear that's a common question. Well, this is just as dangerous as maybe the flu is more dangerous. You know, can you speak to that a little bit?
Yeah, with influenza, we have the advantage of a vaccine, which does not 100% protect you from getting the flu. It can make it so that the influenza you get is less bothersome, less serious, less fatal. And an awful lot of people get the flu shot. Not everybody, obviously, not everybody gets the flu shot, but enough get it that it interrupts the transmission of individual to individual. We don't have a similar vaccine for this yet. That's coming, but and the study should be nearly complete. I think it was the Monday before this is when they started giving the vaccine in California. And by the end of 3 weeks or 4 weeks, they'll have determined whether it's effective and if it's causing any problems. And I think there's going to be a huge push for both health reasons and economical reasons now for the government and many private organizations to get behind the rapid development and deployment of that vaccine. With influenza, we have Tamiflu, which can sometimes ameliorate the symptoms significantly. And the influenza virus overall maybe doesn't seem to be quite as bad as the coronavirus. When you look at the mortality of the coronavirus in the people that develop pneumonia, it's now thought to be in the 2.5% range. And they say that people with influenza, the death rate is 1%. But when you look at the actual death rate from community-acquired pneumonias across the board, it starts at 4% and can go as high as 15%. So it's not like this virus is the absolute worst thing that's ever come along, but it certainly is very serious. And there can be cases of folks that are relatively healthy who get a very, very serious case, very serious illness from it. Again, the vast majority of people with problems are people that you would expect to have problems. and that have compromised lungs, that are on oxygen, that have poorly controlled diabetes, things like that, things that we know are going to interrupt their ability to respond
Sure.
with a good immune response.
I know my grandfather, he's passed now, but I used to worry every year because he was a smoker and he would get pneumonia and he'd have lung problems during the winter. And of course, I was always wondering, could he survive, those instances? And so, of course, we have to worry, as we do with all, situations, for those with underlying issues. Let me ask you this, since we're doing a comparison right now about the flu, many people are comparing this to things like SARS, smallpox, Spanish flu, all sorts of different epidemics, the measles, things that we had when they first came out really did a lot to a population. Where does this rank in comparison to those types of things, in your opinion?
Well, I don't think we've seen anything with it yet. The SARS and MERS viruses and the areas that they've occurred in, it's been kept under good control either through governmental pressures or in the case of the MERS, probably more of an environmental reason that it sort of dwindled out and it's not terribly big. The Spanish flu in 1918, there were no antibiotics in 1918. There was no access to intravenous fluid in 1918. So that's a whole different animal. That occurred in a population throughout the world that had just finished World War I. And I don't think that you can really make the comparison because you can't tell. You can tell that the response to it from humanity was certainly very poor. People didn't do well, but how many of those people that died from the staphylococcal pneumonia, that was the most common cause of death from that influenza, were because there were no antibiotics, no IV fluids. I think in all likelihood, the vast majority.
Yeah. Interesting to, hear you comment on that, because our governor, we're talking about flattening the curves, when it comes to Spanish flu and, government intervention, but we also now have medical intervention to help. When he was comparing it to the Spanish flu and what one government did, we also have the ability to help things a lot more with antibiotics, IV fluids, like you mentioned. So just good to kind of put those two in perspective when we put them side by side. Final thing, from what you're learning, you mentioned the idea of a vaccine that we would, know some things about in the next few weeks. And then, of course, a big pressure to mass produce this and get it out to the people that need it. Any predictions on, maybe a peak to this and maybe a downside to this? Just, I know that you don't have a crystal ball, but anything from, your personal views and your personal understanding of this as to, where we might peak and where we might be on the downhill side?
If you look again on the CDC website, you see that the CDC cases that they test and the curve that they show is a combination of CDC testing and then testing from outside laboratories. And the CDC positive test rate has kind of peaked, and the other looks as if it's kind of peaked, but they don't have all the reports in. And I think that you're going to be able to see that evolve in real time. They post every Monday and every Friday at the end of business days all of the positive tests. So I think that if those are correct, then it may have actually the positive test rate peaked already. Again, we don't know. Well, you and I don't know, maybe somebody someplace knows, but we don't have a way to figure out how many testing kits are out there, how many more are on the way, what's going to be the restriction regulation on testing. That changes honestly day to day. But the CDC has done a phenomenal job on their website, and that's for healthcare professionals. That's our go-to. We read it every night, look for the data every Monday and Friday, and kind of follow their guidelines in terms of evaluation, testing, treatment, etc.
Yeah. Well, let's hope we'll be on the downhill side soon. So then that way we can all get back to normal. I know that, there's many people that are, they're laid off. They're in isolation. They're feeling stressed and anxious and fearful and just not knowing, how long this could persist, whether it's 2 weeks, a couple months. And I know that no one has a crystal ball, but, that is encouraging what you just shared. So thank you for that. And I would encourage people to go to the CDC site, you know. Right?
Pretty normal in 3 weeks, normal in 3 months.
Okay, very cool. Thank you. Thank you for your time. I know how busy you are during this time. How has this changed your teledoc? Are people able to have more access to you through teledoc? I heard something on the news where, you know, that there's more of that going on. Are you doing more of that, or?
Yeah, we do now in the office. I do as many telemedicine or video visits each day as I normally would see patients. So the numbers of interactions haven't changed. Relatively few of those have to do, everyone has questions, of course, about the COVID crisis, but very few of those have anything to do with COVID. It's across the board, taking care of folks with blood pressure issues, blood sugar issues. Respiratory issues do come up, and you know, we just make sure that we try to keep the patients who are at risk at home, relatively isolated, and take care of them over the video.
Are you accepting any new patients at this time, or screens or things like that, that if somebody wanted to reach out to you to maybe have some sort of visit such as that? Or
yeah, folks can certainly reach out. It makes it a bit more limited for folks if I've never met them, but it's certainly a way we can do it. And we have it set up through our electronic medical record, but for folks whose computers may not be as easy to access, we can do it with FaceTime and Skype. And we've gotten the go-ahead from the insurance companies and the government organizations to do that.
Awesome, awesome. Well, thank you for being such a friend to us and such a friend to Journey, as to, you know, give up your time this morning to try to give us some facts and, you know, put everybody's mind at least in the right perspective. My goal here today is just to try to give the facts as they pertain to our area and from a known and trusted source. So thank you for being that source for us this morning. Appreciate it.
Thanks for inviting me, and the work you're doing with Journey with the video workouts is phenomenal. We're having a great time with that.
Well, thank you. Thank you for participating. You know, we got to stick together as a community during this time. So thank you. Thank you very much. All right.
Thanks, Travis.